In this video, we'll be covering what's new in Ozmosi, specifically in our data offerings. We've recently added these three key elements and a few items around these. These are really driving kind of the value impact, as well as supporting even further some of the analytics that some of our customers were looking for in our data, specifically around investing in different companies in the pharmaceutical and biotech marketplace. So you might look at these at first glance and wonder, how excited do I need to be about value index, probability of success and launch, and timing? And I'll walk you through that in these next few minutes, but also please do check out our other videos around how to use our data for long-term and short-term investments, where we'll show you specifically through a Jupyter notebook how you can approach your investment using really the results of this information. So let's walk you through the information itself. So if you're interested in investing and understanding kind of who's got the best clinical pipeline out there in the pharmaceutical or biotech space, these new improvements will get you there quickly. And what's important is not just what that value is, what the pipeline index looks like for these companies, but even when we'll be hearing more information about those. And that really puts into context for us when we're listening to the news reports about a certain clinical trial, success or failure. It puts it into perspective in terms of how much of an impact is it on this company. I mean, you can go further than that, right? We can look at all of these top 20 companies, perhaps in terms of the disease areas they're investing in, somewhat of a heat map that shows where the intensity is clinically and where there might be some white space or some blue ocean for some of these companies. An additional perspective on this might be kind of at the phase-based approach, so you can see how far along are they in these investments. And so this is the same set of 20 companies, but this time it's actually ranked by their early pipeline. So whoever has the lightest pipeline early on is at the top of the list, and those that have the heaviest early pipeline are lower on the list. And that's really important information if you want to look at who might be paying a premium for their M&A activity in the near future. Now, we expect almost all of these top 20 companies to be purchasing some companies in the next year or so, of course, but we can see those that might be more willing to pay a premium, those that might be out there more often than others. So really, we might want to maybe give some of those at the top of the list a little bit more of a break if they're paying a premium because they're kind of climbing out of that hole, versus some of those in the middle that might be paying a premium when they really didn't need to be. Now, when we have this information about really the investment space in terms of the therapy areas that these companies are investing in and how early, how far along those investments are, it really gives us some insight in terms of the smaller to mid-sized companies, which are more likely to be picked up through M&A activity in the next year or so. And that allows you to rank that and highlight which ones are even a better fit. And you'll see some of that in terms of that matrix in the other video for the long-term investments. So please check that out. And of course, back to the catalyst timing. In this case, the catalyst dates being when we might expect to hear some readouts from clinical trials, really putting in a level of importance, not just what the news is, but how that may or may not impact that company and its likelihood to be picked up by one of the larger companies in the near future. Now, just a little bit about what goes into this. Some of our competitors are able to deliver the likelihood of success. Most of them are delivering this pretty much just based on the disease areas that the clinical trials are taking place in. That is, of course, very important, but we've added a few more dimensions in terms of how novel the treatment is and the company's experience. And this plays out every phase of the development, and we found to be very important also in the regulatory portion of this. So our regulatory likelihood of success is based on each of these as well. And you can see we have a pretty deep bench of data to draw from. So that we're pulling from across 80,000 clinical trials to deliver this information to you. We're also incorporating company announcements as well as the approval history and the filings from the companies and from the government. Now, when we talk about the actual value element of this, we're also pulling in additional data to assign to this clinical trial data. We are pulling in information from the World Health Organization around the disease burden that clinical trial or that drug is trying to treat. We're also looking at the willingness to pay, because the burden may be the same across two diseases, but the willingness to really pay for the treatment of those can vary. We're seeing that varies across different disease areas. And we've got the data in terms of pricing from a number of places to really tease that out further. And of course, how crowded is the marketplace in terms of the clinical and scientific focus across a number of companies and different therapeutic approaches? And finally, whether or not the therapy being studied is even novel or isn't an older therapy trying to be used in a new approach, which is still great, but very different than when we're looking kind of at the innovation factor. And last but not least, we have catalyst dates. This is catalyst dates regarding when we expect to hear clinical trial readouts. When will we hear how well did that trial do? Is there hope for this company or not? Now, in order to do that, we pulled in over 500 company announcements, tied these to clinical trials. We tied these to industry conferences. We also included some really important data elements around the disease area that the trial was conducted in, the recruitment rate, and we can make good predictions on that based at the company level. And of course, primary and secondary endpoints, specifically the timing around those endpoints. That's what helps us make these predictions. Now, you can see the actual events where the announcements are made are all over the map. If you look at that 0 in the middle, you would go in that bar if the announcement was made on the same exact day as the primary completion date. The difference between those two dates would be 0 days. Most of the announcements come between 60 and 90 days after the primary completion date. That makes sense. The trial needs to end. They need some time to evaluate the information and summarize it and then report it out. But you can see it's really all over the map, anywhere from a year after to a year before. There's a lot that goes into this. And so you don't want to just add something between 60 and 90 days if you're trying to make an investment decision. You can see here in our model by the red bars that we can make predictions fairly tight to when they're actually coming and really pick up on some of that spread. It's not perfect, but we're definitely improving on that. And what that allows us to do is then provide you with the prediction dates here that you could really start to invest around when we think we're going to be hearing from these companies. So please check out our other videos on how to actually apply this data to your investment decisions. Those videos are around long and short-term investments. And thank you for your time.